Hey there, it's Dr. Tait, Regenerative Medicine expert, and I had a great question today in a consult. So I left up there on the board what we talked about, and the question I got was, what is the difference between a, say, pain specialist versus an orthopedic surgeon versus a regenerative medicine expert, somebody that specializes in the treatments and procedures that I do in my practice. So very simplistically, it's up here on the board. If we look at the first column is training. So what's the training of a pain doc? They've gone through different specialties to get there, usually anesthesia or maybe physical medicine or rehab like myself. And then they've gone on to do some pain fellowship training, specific treatments to treat pain. What about an orthopedic surgeon? Pretty obvious. They went through a residency to do orthopedic surgery and maybe they did a fellowship afterwards. What about a regenerative medicine doc? Well, in that case, again, different pathways lead into that. Could be family medicine, could be internal medicine, could be physical medicine rehab like myself, and then ongoing training after that, usually through different fellowships or continued education for people that are teaching these type of procedures. So if we jump down and we look at the tools that are commonly used, in the pain doc scenario, what we're talking about most of the time is medication. So the tools that they're using in their practice are NSAID medications, opioid medications. We get into procedures, a lot of it involves corticosteroid injections to nullify pain and suppress inflammation. And they may do some other procedures such as burning of nerves. We're talking about joints in the spine. It's called radiofrequency ablation, different procedures like that. And then it can get more invasive. They can put pumps in and stimulators and things to block pain, implant devices in the spinal cord. If we jump over to the orthopedic side of it, obviously the main tool after, say, maybe a failure of the medications to produce the result we want, then it goes to surgery, right? That progression is pretty well, I guess straight and narrow. It's if you're not getting better with those medications, opioids, corticosteroid injections, well, then the next option is surgery. In the middle, me, the regenerative medicine doc, thinks about things a little bit differently. And what we're looking at is from a nutrition supplement standpoint, can we get the body in a state where it can heal? Can we take down the inflammation? Can we put the right supplements on board to help turn the wheels on tissue healing? And then we move into movement, physical therapy. How do we rebuild the body mechanics to make things move more efficiently, take the stress off that injured tissue? And finally, then we nudge the body with these regenerative treatments. So we get into stem cell therapy, PRP and prolotherapy, which I have other videos about and information on my website. These treatments are designed to stimulate that regenerative process in the body, get the body to heal versus, say, blocking the medication or blocking the pain with medications, cutting out the problem potentially, plugging in new artificial parts. So here, we're looking to keep your parts, we're looking to drop the pain, improve your quality of life, improve your function, and give you another option in this middle space so that if you're not interested in surgery and you're not interested in, say, ongoing medications, well, this is that space where we should be looking. Many patients live in that middle space. I talk about it a lot in my practice, and it really becomes a balancing act between these worlds. But if you don't know that this exists for you as a potential option, you don't know to look for it. So now you do. The other point is kind of the balance point here of, say, damage and demand. Another very important concept here. So what type of things are we trying to counterbalance that damage and demand in a joint, say if we're talking about arthritis or a tissue tendon, different types of injuries like a rotator cuff or Achilles tendon, patellar tendon. Well, we have some damage there, but we're also putting demand on that. So we want to think about what can we stack on this side of that balance to shift the body back in that direction that it can repair and regenerate, and that's why our focus is here. Nutritional supplementation, movement, again, correct the things that are putting undue demand on it. May have to change the amount of activity somebody's doing temporarily to allow that tissue to catch up. And eventually we can stimulate it, nudge that tissue to heal with treatments like stem cell PRP or prolotherapy. And the final concept I'll talk about, which we did today in the consult, is the ball rolling down the hill. So very simplistically, I want to look at your health as a ball rolling down a hill. So if we look at a ball at the top and you feel like it's rolling down the hill, where are you in that spectrum, okay? Do you feel like you're at the top and felt the decline, or have you been declining for a long period of time, right? And if you're somewhere in this middle space, wherever it might be along this progression, how can we catch the progression of decline, whether it's a joint function, pain, or overall health issue, slow that progression down or halt that ball rolling down the hill? So with arthritis, again, typically once the ball's set in motion, it continues to roll down the hill. You end up on this side of the board here with something called a total knee replacement. But there's many options in this middle space. This is where I operate. This is where I specialize in these kind of things to slow that progression, and hopefully people don't get to that bottom of the hill. So thanks for watching the video. Check in on our website with information about this. Look for future webinars on these topics. We're always offering those as another way to learn more kind of deep level stuff about the treatments we do. Thanks so much.